Okay, so let's talk about the physician's desk reference. This is one of the premier medical reference journals databases in the world. Doctors, raise your hand if you have a copy of this book in your practice. If you have a copy of this book, the PDR, in your practice, raise your hand. What? Okay, well, a couple out here, good. This, I don't know, this is a common reference that is in doctors' offices. It provides information on what compounds, what pharmaceutical drugs are out there that can help with a particular need state. The PDR talks about what the product is, what the active components are, what are the side effects, what's the mode of action, how the recommended use, all those sorts of things. It's an encyclopedia for medical professionals. This is published by this organization, the Physician's Desk Reference, and it is the gold standard. In this book, you have thousands of pages, 2,000 pages or so. Go through that book. Most of that book is dedicated to pharmaceutical companies, the big players, Amgen, Merck, Pfizer, GSK, Roche, Genentech. Okay, they have their prescription drugs in there. Okay, so 99% of the PDR is prescription drugs. But there's a small section in the back. Where certain nutraceutical companies who have been vetted by the PDR, and the PDR thinks that they are science-based, have their products in the back. Okay? So the PDR is the authoritative source for prescription drugs. It is very difficult to get listed in the PDR. To get listed in the PDR at the beginning, you have to submit a lot of data. They ask what papers you've published. They ask what your research budget is. They ask a lot of different things to get into the PDR. A lot of times, companies will submit an application to get into the PDR and they never hear back. It's very difficult to get into the PDR. We are in the PDR because we are a science-based company. We are a pharmaceutical grade company playing in the nutritional supplement space. Now you ask, why do we do that? Why if we do pharmaceutical grade science, why don't we just go through the pharmaceutical route? Well, there's a couple reasons for that, but one of the major reasons we do that is if we sold these products as pharmaceuticals, would you be able to have them? Would you be able to give them to your family and friends? Huh? No, right? You would have to go through a doctor. We at Unicity feel like everybody should have these products, so we open it up. We play in the nutritional supplement space so that everybody can have these products. So, as I said, there's a small section where there are a few nutraceutical companies in the back. We have twice as many products in the PDR as our next closest competitor. We have more products in the PDR than any other nutraceutical company. Period. And the reason why there aren't more nutritional supplement companies in the PDR, I think I mentioned this yesterday, they're not in the PDR because they can't get in the PDR. They don't have the pedigree. They don't have the tradition, the science base to get in.